But something I think to be proud of to start with today, Dorset County Hospital is reporting that the team there have recruited the highest proportion of potential participants to a COVID-19 recovery trial of any hospital in England. This study is currently the largest one into potential treatments in the world. It hopes to have significant data to report as early as next month. And we can find out a bit about it now with Jon Chambers, who's a consultant anaesthetist in charge of that recovery trial at DCH. Joins me on the line. Jon, good morning.
Good morning, Steve. How are you?
Really well. Talk me through this study. What is it looking into?
Well, there's been a lot of talk, quite rightly recently, about the search for a vaccine for coronavirus, but that is still a long way off. And so a team based in Oxford has been running the recovery trial, which has been looking at potential treatments, anything that we can find that may help reduce the number of deaths that we're seeing from coronavirus. And so from early on in April, we've been starting to support patients who are being recruited into this trial, to see if some of the medicines that we use for other illnesses could be repurposed to help people with coronavirus.
And these are medicines that are used for malaria treatment, HIV, rheumatoid arthritis. And this line this morning that Dorset County Hospital is having the most success in getting patients to sign up to this trial.
Yeah, we're by no means the biggest hospital involved in the trial. It's throughout the country. But we were really pleased to hear from the team in Oxford who run the trial that we've been doing really well about supporting our patients to get access to these treatments, which has been great for our patient population in West Dorset.
Yeah, well, we'll come to the morale boost of that in a moment, but just talk me through how it works. So somebody comes to you presenting with symptoms of coronavirus, and there's a discussion at some point early on in their time with the hospital as to whether or not they want to be part of this study?
Yeah, I mean, we're obviously really aware this is an incredibly anxious time for our patients. They are obviously worried about their potential diagnosis, but anybody who comes into the hospital who's either suspected of the symptoms of coronavirus or has had a test that's proved them to be positive coronavirus can participate in this study. So whilst they're getting the standard care that we would be offering to all patients at the hospital, they have the option of joining into the study, which then gives them some alternative treatments which may help them in their recovery.
Right, and what about the impact that news like this, the highest proportion of sign-ups in England? This is a time when I'm guessing that medical staff are struggling with the hard work, bad news, dealing with a large number of deaths and, all the kind of various complications we've talked so much about. But then you've got something like this, which presumably is a little fillip for them.
Oh, it definitely is. I mean, I have to pay credit to the clinical teams at Dorset County, the doctors and the nurses who've been working so hard over the last period of time to support patients at this very challenging time. But also, it's an opportunity for us as a hospital to participate in nationwide research. Recovery is the largest clinical trial in the world at the moment, looking into coronavirus potential treatments, and so to be looking into treatments where it may make a massive difference in the future if we can find something that helps reduce the number of deaths is great for our clinical teams.
Jon, really good to talk to you. Keep up the good work. Thanks for coming on.
Steve, can I just say one other thing?
Please do.
Just really to say thank you hugely to our research team who've worked tirelessly over the last period of time, looking into helping support patients, particularly our pharmacy team as well, and also Dr. Jenny Graves, who's worked so hard to piece all of this together. But most importantly, to our patients who have taken the chance to be involved in our research, which will help others in the future. So that's been brilliant for us.
Jon Chambers, consultant anaesthetist at Dorset County Hospital. BBC.